everyone, welcome back to our channel. I'm Dr. Ramel from City Skin Clinic, and today I wanted to have a chat about do's and don'ts after you've had Botox and fillers. This is a really important topic. I think there's a lot of confusion about what you can and can't do straight after you have Botox and fillers, and I was going to share the advice that we give our patients and explain some of the rationale behind it. Before I get started, if you're new to our channel, welcome. Please don't forget to subscribe to our channel, and if you're a returning visitor, welcome back. It's great to see you again. As you know, City Skin Clinic, we specialize in non-surgical aesthetic treatments, and that means we do a lot of treatments like Botox and fillers in the face and other parts of the body. One of the things that we always make sure that we emphasize with our patients is aftercare, and we try and keep it as fuss-free as possible because you don't want to have a whole bunch of instructions, so we keep it to the necessary and to the things that are going to matter, and they're all evidence-based as well. And that includes a few tiny do's and don'ts after Botox and fillers that just make your aesthetic journey much easier, and they avoid the risk of any problems or complications. I'm going to really largely deal with Botox and fillers in the face in this video, but this often applies to the rest of the body as well. There are a few things that we advise for both. That's a common pathway. So really, these treatments are very low maintenance, and they are often quick procedures that you can get done, return to work or go home or live the rest of your life. But the main thing to remember is both of these involve injections. They are medical treatments, so we have to just approach with a little bit of care and respect. One of the big things we advise people is not to touch the treated area for at least 4 hours after they've had their treatment. So if you think of it, it's like if you get a blood test or a vaccine, and they're going to stick a little plaster on your arm that stays on there for a few hours, and that just protects the injection site, which is ultimately a wound. Now obviously, if you're getting Botox or fillers on your face, we're not going to put tiny little plasters all over your face, but what we do is apply a balm to that area that protects it, and then we just ask you to not touch that area. And the reason we ask you not to touch that area is our hands, even if they're clean, risk spreading bacteria, so we want these tiny holes from the injection to close up and heal. So really, at least for 4 hours after the treatment, then we just say avoid doing that. The other thing that we would advise you is for that period to also avoid putting any makeup. So in our clinic, after the treatment, we make the face look great, not just because of the treatment, but also because we're aware that you can't apply any makeup or cover up there. So we will apply balm and just make it look like you've had a little bit of a facial. So I think that's a really good kind of way to conceal some of that, is just having a post-treatment balm to hand. Luckily, you know, every cloud has a silver lining, but these days we're all wearing face masks, so that makes it a little bit easier to keep your hands off your face. And also, if you have a bruise or anything, you don't need makeup, just put your mask on. The one thing that we will also encourage people not to do is exercise strenuously immediately after treatment, and I'm going to explain how that relates to Botox and fillers in a second. But yes, the main thing is do not touch that area for the next 4 hours at least. And then at the end of the day, when you're getting ready for bed and you wash your face, it's perfectly fine to wash your face, but we just advise be gentle. When you're washing your face, you know, it's kind of this and this rather than, which you shouldn't be doing anyway because it accelerates wrinkling. And it's the same with drying your skin. You're going to be patting it gently, and you're going to be massaging very gently your moisturizer or any of your serums at night. So you don't have to skip your skincare steps, you just need to be gentle, and actually you should be gentle anyway with your skin. With regards to Botox itself, the one unique thing that we would advise after you've had Botox, particularly to the face, is not to lie flat for the next 3 to 4 hours. So I would probably say for the next 4 hours. This is just to avoid any risk of migration or anything like that. So if you have your treatment in the evening and you're going to sleep in less than 4 hours time, prop your head up on a couple of pillows. So that's just generally the advice that we would give. Usually it's not a problem. Most of our patients go to sleep quite late, so even if they have their Botox at 8:30 p.m, they're not going to be sleeping in the next 4 hours anyway. But that's something just to bear in mind. Don't lie flat in the next 4 hours. That's probably the better instruction. So that's with Botox. You don't want to be touching your face for the first 4 hours. You don't want to be lying flat for the next 4 hours. And you definitely don't want to massage your face in the first, I'd say, 12 hours of having Botox, but you can wash it gently, as I mentioned. The other thing you need to kind of be wary of with Botox is I generally discourage vigorous exercise on the day straight after you've had Botox. So in that first sort of 12 hours or so, some people say 24 hours, it's not that it makes any difference to the Botox itself, it's more that if you've had a little bit of bruising, it can be exacerbated by that. What I would say is in that first 4 hours where you're not lying flat, you're also definitely not going to be doing any exercise that's going to require you to bend forwards or to bend backwards. So as a general rule, to be safe, I would just say avoid any strenuous exercise just for the rest of the day after you've had Botox. I'm okay with people exercising the next day. It's not going to affect the Botox, and it's not going to, unless you've had some extensive bruising, it's really not going to make much of a difference at all. And there's no swelling after Botox. So, and I mention that because there's something with fillers that we have to be careful of. Also, do not press on the area for the rest of the day. So if you've had Botox in your forehead, do not wear a helmet, do not wear a headband, nothing that kind of presses on that area. So that's really important to bear in mind, but sleeping is fine, just as long as you don't lie flat for the first 4 hours after treatment. So that's Botox. It's relatively simple, and this is just general aftercare advice. With regards to filler, the advice is really centered around swelling. So again, with filler, we've mentioned, like with Botox, you're not going to be touching the injected area for the first few hours. The second thing that we absolutely discourage anyone from doing is massaging the treated area at all. And I would say not to massage the treated area for a couple of weeks. You can touch the area, you can apply gentle pressure, you can apply makeup, you can apply balms, you can kiss, you can do all of the things you normally would do, but don't vigorously massage it. And if you notice any swelling, any lump, any unevenness, get in contact with your practitioner and they can advise you. So in our clinic, if someone has any asymmetry or a lump, we just bring them into the clinic and take care of that for them. The reason we just say not to massage the area is, although filler's been placed in the layers that it should be, within the first sort of few days, it is possible to manipulate it a little bit. And I think if you are massaging it, then potentially you're displacing it and you're not really, you don't know what you're doing. And on top of that, if there is a problem that you're having, really the best thing to do is get in touch with your practitioner, who can just make sure that things are settling the way they should be. Because filler, particularly lip filler, there's usually some swelling with lip filler that goes down in the first few days. As it goes down, you can notice the appearance of unevenness or potentially a little bit of lumpiness, that may be a lump or that needs massaging, or it may just be that the swelling hasn't fully settled and that resolves. So you don't want to take any drastic action. So that's kind of the first thing we advise, is not to massage it, particularly filler in areas that have a high risk of swelling. So the lips is one, the chin and the jaw is another. we will encourage people to ice that area for the first night after they've had the treatment, and potentially the next couple of days if there's any swelling. That really helps bring the swelling down super quickly, and it helps speed up the recovery process. Now, you don't have to do it, but it really helps if you can do it. We give away little ice packs at the end of these treatments for that reason. The other thing that we encourage you with filler, especially if you're someone who's prone to swelling, is, and I do this with everyone who's, especially if they've had lip filler or chin filler, just advise you to sleep that night with your head propped up on 1 or 2 pillows, and that again helps reduce the risk of swelling in the morning. And on the topic of swelling, one of the things that causes swelling is extreme heat, like being in a sauna or vigorous, strenuous exercise. So we generally advise people to kind of avoid strenuous exercise for the first couple of days after filler and going to saunas, and that's really just because of swelling. It's not going to affect the filler itself. And for some patients, they say, you know what, I really need to exercise for my health, for my well-being, or I'm training for something, and that's not a problem. You can absolutely exercise and ignore that, but just be aware that you may have more swelling after you exercise, and the kind of solution is as simple as take an ice pack with you, or after you've stopped exercising and you've returned home, just ice the area to bring back down that swelling. So it's again not a hard or a fast rule, and really with these treatments the only two absolutes are the not touching the treated area immediately after the injections for the first 4 hours, and with Botox not lying flat for that period, and with fillers not massaging the fillers. Those are the only real things that can affect the outcome of the treatment and give us results that we don't want. Everything else is just about making the recovery period as quick and as fuss-free as possible. And again, this is why it's really important you discuss your schedule and what your kind of lifestyle is like with your practitioner, and they can help with that. So those are kind of the main key takeaway messages. I want you to know that, you know, Botox and fillers, they are really accessible treatments. They are very minimal hassle, but it's important to recognize they're medical treatments, and there are a few things that we do to make sure that you optimize the outcome and you speed up the filler settling in, or the Botox working, and minimize any risks or complications. And then really it's just smooth sailing from there on. And one of the things that you should always make sure is after you've had Botox and fillers, so we send detailed aftercare advice to our patients, and that includes warning signs of things to look out for, what's normal, what's abnormal, and this is something that your practitioner should also give you. So really, beyond some swelling with filler, a small risk of potentially bruising with Botox and fillers, there really shouldn't be any other problems, and if there are, you absolutely should contact your practitioner. Most of the time they will reassure you. They may need to have you come in to make sure that everything is fine, or, you know, in a scenario where something has happened, they can deal with it. Anyway, I hope you found this video useful. I thought it was for a lot of our subscribers and people that watch our content and visit our website. I know that you're potentially new to Botox and fillers, and this is an area that is really important to know the full journey, including the aftercare part. Anyway, I'm going to leave it at that. If you have any questions, please leave a comment below. If you haven't subscribed to our channel, please hit the subscribe button and the notification icon, and don't forget to give this video a thumbs up if you like it. And until next time, stay beautiful.